everyone, and welcome to today's update on COVID-19 in New Brunswick. Bonjour tout le monde et bienvenue à cette mise à jour sur le COVID-19 au Nouveau-Brunswick. Speaking on behalf of the province today are the province's Chief Medical Officer of Health, Dr. Jennifer Russell, and the Honorable Dominic Cardy, Minister of Education and Early Childhood Development. Les porte-paroles aujourd'hui sont le médecin hygiéniste en chef, le Dr. Jennifer Russell, et l'Honorable Dominic Cardy, ministre de l'Éducation et du Développement de la Petite Enfance. Dr. Russell.
Thank you, Bruce. Merci. Good afternoon, everyone. Bonjour à tous et à toutes. Avant de faire la mise à jour des cas de COVID-19 aujourd'hui, je tiens à vous fournir tout d'abord des renseignements sur quelques questions. L'éclosion au complexe Parkland St. John, la définition d'un événement super contaminateur, le retard dans les tests de dépistage à St. John, la transmission communautaire et soutien pour les proches aidants et les personnes vivant seules. So before I provide today's COVID-19 case update, I would like to take this opportunity to provide some information on a few items. The Parkland St. John campus outbreak, the definition of a super spreader event, St. John testing backlog, community transmission, and caregiver support and those living alone. So to date, there are 15 confirmed cases at Parkland St. John, 5 employees and 10 residents. There will be another round of testing Parkland St. John residents and employees that began yesterday, and another round of testing continues today. So a total of 69 individuals were swabbed at the adult residential facilities yesterday, and today testing will occur at Tucker Hall. Results of the Parkland St. John campus testing will be known over the coming days. I would like to acknowledge the excellent collaboration between Parkland St. John and the extramural program and Ambulance New Brunswick members of the prompt team who have been on site to ensure testing and support infection prevention measures. Récemment, Santé publique a été appelée à préciser ce qui constitue vraiment un événement super contaminateur. Il s'agit d'une situation dans laquelle il est possible de retracer un nombre important d'infections à un rassemblement ou un événement en particulier avec des transmissions d'infections attribuables à une seule personne ou à un petit groupe de personnes qui ont assisté. Recently, Public Health has been asked to clarify what is an actual super spreader event. This happens when a large number of cases are traced to a single gathering or event, with COVID-19 being transmitted from one individual or a relatively small number of individuals who were in attendance while infectious. Recently, Public Health has been asked to clarify that event. So the Public Health has confirmed that there was a super spreader event, and that occurred at 2 venues in the course of one evening and is directly responsible for 60 confirmed cases in Zone 2 to date. The event is responsible for more than 80% of the current active cases in this particular zone. And we have determined that 34 people who have attended the super spreader event have since contracted COVID-19. And a further 26 cases were contracted indirectly when attendees infected others that they came into contact with. Nous avons déterminé que 34 personnes ayant pris part à l'événement supercontaminateur ont depuis contracté la COVID-19. Les personnes présentes ont ensuite infecté 26 autres personnes avec qui elles sont indirectement entrées en contact. Our information suggests that an individual or individuals who were asymptomatic or pre-symptomatic at the time went to the event and originated this outbreak. And this isn't about casting blame, it's really about a teaching moment when we know that in other jurisdictions such as Ottawa, Newfoundland, even in Maine, there were super spreader events like weddings, funerals, etc. So clearly, individuals in these types of situations have no way of knowing that they're carrying the virus when they go to these types of events. And I have been hearing that it's not really fair to tell people that telling people that if you act as if you have COVID-19 or the people that you're with have COVID-19 all the time, that's a challenge. But really, it's about empowering yourself with the knowledge of how to protect yourselves and your loved ones. So I don't ever want people to be afraid. I want them to be informed and knowledgeable. But if people are afraid, again, that's a genuine, valid feeling. But again, arming ourselves with knowledge and the right pieces of information to protect ourselves is very important. So it does illustrate why it's important that every New Brunswicker follow public health guidance when you are in public. And it also demonstrates the complexity of determining the source of any outbreak, and it reinforces the importance of masking and physical distancing at all times. Not just so that you don't become infected, but so that you don't inadvertently infect others. Cet exemple illustre clairement pourquoi il est si important pour tous les citoyens du Nouveau-Brunswick de respecter les conseils de santé publique en public. Ce cas démontre à quel point il est difficile de déterminer la source d'une éclosion et renforce l'importance de porter un masque et de respecter les règles de distanciation en tout temps. We have seen super spreader events, as I mentioned, in other jurisdictions like Maine, Ottawa, Newfoundland, and we know that they can be upwards of 200 people that are implicated in those types of outbreaks. So in this particular case, we don't know all the circumstances of the super spreader event. We just want you to know that the virus is able to spread in these events if people are not physically distancing and not wearing their masks. So it is not possible to always know who is carrying the virus, and so that is why it is really best to assume that at all times everyone around you is infected and act accordingly, or act like you're infected and act accordingly. Concerning the backlog of testing in the St. John area, we have seen a lot of improvements in that backlog, and my understanding is that over the course of the last several days, they've done a total of 1,379 swabs. That includes Saturday, Sunday, and Monday. So the individuals that have been waiting more than 48 hours for a call for a testing appointment, we discussed this with the team yesterday, and the best approach at this point, again, because there have been some gaps, is that you resubmit your online request for a test, and that way, again, we're closing those gaps and addressing that particular part of the backlog. Lorsque Santé publique annonce les nouveaux cas chaque jour, nous précisons habituellement si ces cas sont liés à des voyages et à des contacts étroits avec un cas déjà confirmé, alors que nous indiquons que d'autres cas font l'objet d'une enquête car le lien entre les cas n'est pas toujours évident dès le départ. When public health reports new cases each day, we typically list these cases as travel-related or contact of a previous case, and I think many people are reassured to know when those people were already in self-isolation when they were diagnosed and therefore not at risk of transmitting. But there are some others that are under investigation because we haven't been able to establish the links between cases because that may not be apparent at first. So we undertake a rigorous contact tracing process, and I think there was an article on contact tracing that CBC did earlier this week with one of our top contact tracers. They are an extraordinary team, I have to say, so I'm going to give them some kudos in a bit because they really, really deserve a lot of recognition for what they do. So we undertake a rigorous contact tracing process to determine when and where new cases are not linked to existing case clusters. Community transmission, where no link to an existing case can be made, has been relatively rare in New Brunswick, just 3% of all confirmed cases in New Brunswick. So this is very different in other provinces, and certainly in Halifax right now we are seeing community transmission. So again, compared to other places at the current moment, we are doing better than other jurisdictions. And just to highlight that, when we look at the number of active cases currently in New Brunswick, we are doing very well. The Atlantic provinces as a whole have been doing very well, as have the Northern Territories. So the rest of Canada has been having many, many more challenges with the second wave of COVID-19. So I would like to thank our contact tracing teams whose tireless efforts have enabled us to establish links, sometimes relatively distant links, between most infected individuals in New Brunswick. We are making progress in limiting the spread of COVID-19 in New Brunswick, but we are still seeing new cases each day. And as a last comment, I do want to remind New Brunswickers that no one should feel that they are required to be alone during the orange phase. It was never our intention to not have people who live alone have the ability to have contact with caregivers, etc. So our mandatory order permits a neighbor, caregiver, or a family to support someone who is alone, whether there are needs for mental or physical care supports. So please call and check in on those that you know are living alone. We must be there for one another. And alors aujourd'hui, Santé publique annonce qu'il y a 7 nouveaux cas de COVID-19 au Nouveau-Brunswick. Dans la zone 2, qui comprend les comtés de Saint John, Kings et Charlotte, il y a 4 nouveaux cas, une personne âgée de moins de 19 ans, une personne âgée de 20 à 29 ans, 2 personnes âgées de 50 à 59 ans. Dans la zone 3, soit la région de Fredericton et du centre du Nouveau-Brunswick, il y a 3 nouveaux cas. Une personne âgée de moins de 19 ans, une personne âgée de 50 à 59 ans et une personne âgée de 60 à 69 ans. Today, Public Health is reporting 7 new cases of COVID-19 in New Brunswick. In Zone 2, which is St. John, Charlotte, and Kings counties, there are 4 new cases, 1 individual under 19 years of age, 1 individual 20 to 29, and 2 people 50 to 59. In Zone 3, which is Fredericton and Central New Brunswick, there are 3 new cases, 1 individual under 19 years of age, 1 individual 50 to 59, and 1 individual 60 to 69. Currently, there are 116 active cases of COVID-19 in New Brunswick, with no individuals currently in the hospital. On Monday, New Brunswick marked a significant milestone in our journey through this pandemic as we passed 500 confirmed cases of COVID-19. It has taken us more than 8 months to reach this point. Même si ce chiffre fait réfléchir, il ne faut pas oublier que nous aurions atteint ce jalon bien plus tôt et que nous aurions eu davantage de chagrin, de maladies et de décès sans les efforts inlassables déployés par l'ensemble de la population de Nouveau-Brunswick afin de respecter les conseils de santé publique pour ralentir la propagation de ce virus. I thank you, each and every one of you, for all that you do and continue to do in the months ahead. In particular, I want to thank the hundreds of New Brunswickers who have followed directions to self-isolate. You have helped us slow the spread of COVID-19 and have prevented further infections. I want to remind everyone who may be experiencing COVID-19 symptoms, no matter how slight, to seek testing, and this will help us get ahead and stay ahead of the course of this pandemic. We are making strides towards returning zones 1, 2, and 3 to the yellow phase of recovery, but we aren't there yet. If we all remain vigilant and do our best to keep COVID-19 from spreading, I am confident we can achieve this goal. Nous réalisons des progrès en vue de permettre aux zones 1, 2 et 3 de revenir à la phase jaune du plan de rétablissement, mais il reste du chemin à faire. Si nous continuons à faire preuve de vigilance et à faire notre possible pour empêcher la propagation de la COVID-19, je suis convaincue que nous réussirons à atteindre notre objectif. Thank you very much.
Good afternoon, everyone. Bon après-midi, bienvenue. So since the update I provided on the education system last week, we have had 1 additional confirmed case of COVID-19 in a public school in New Brunswick. On Sunday, November 29th, the school community of Harrison Trimble High School in Moncton was made aware that a positive case of COVID-19 was confirmed at that school. And as of last night, a total of 8 Anglophone schools have been impacted with positive cases and 1 possible exposure across zones 1, 2, and 3. De plus, 2 centres de la petite enfance ont enregistré des cas positifs. We've had a handful of classes at Hampton Middle School, Lakefield Elementary School, Centerville School, and Montgomery Street School continue to learn from home this week, and I'm pleased that we've been able to continue minimizing any impacts on learning. Je veux profiter de cette tribune pour rappeler à toutes les familles qui ont des élèves qui poursuivent leurs apprentissages scolaires à domicile, et même pour les jeunes qui profitent du mode d'apprentissage mixte habituel, qu'il y a des services de TI à distance accessibles pour vous aider à résoudre toute difficulté d'ordre technique. Le centre d'appel de Bell pour vous aider à répondre aux questions concernant Office 365, Teams, DDL ou le Wi-Fi. Le numéro de téléphone à composer est le 1-822-453-1140. I get that this is an incredibly stressful time for families, and many of you have struggled with decisions, including on whether or not to send your child to school. I know this isn't easy, but please let me reassure you that no news continues to be good news when it comes to COVID-19. We've always said that if you or a family member has been in close contact with any cases, you will be notified directly by public health. Again, no news is good news. All the way through the pandemic, we've been committed to protecting the privacy of students and staff per the Personal Health Information Privacy and Access Act, but we'll continue to ensure that your right as members of the public are also upheld and that you're updated on all of our work to help keep your schools healthy and safe. We're confident in the plans that we've prepared. We hope you are too. Recognizing again the anxiety that the COVID-19 pandemic has presented, but at the same time, so far, our plans have survived contact with the virus on numerous occasions. This year with the pandemic, it's been stressful on everyone, and an increased recognition of the importance of school when it comes to the mental health and well-being of our students, not just their academic learning paths. So, in light of that, the critical importance for all students of having access to school, for socialization, even if restricted during COVID-19, connecting with others. Unless you've heard from public health, if your school's open, please send your kids to school. We know things are different, but it's still a chance to learn, it's still a chance to grow and to socialize, and students need that. And as Dr. Russell said, we have to assume that the virus is around us. So keeping your kids out of school isn't offering protection. It may be reassuring, but I'd ask parents to consider the potential impacts on the long-term futures of their kids. We've already seen and heard of the learning impacts caused by the disruptions COVID-19 has created in our school system and across the province. So the more that we can do together to not compound and add to those problems, the better. Durant les derniers mois, nous avons collaboré de près avec les autorités des directions, des districts scolaires, des écoles, avec les autorités de la santé publique et d'autres partenaires pour mettre en œuvre des lignes directrices afin de maintenir le système d'éducation ouvert, même avec un petit nombre de cas signalés, de sorte que les enfants puissent continuer leur apprentissage en sécurité durant la période de pandémie que nous vivons. Si nous devons agir pour faire la transition vers les écoles en ligne pour les raisons de sécurité, nous n'hésiterons pas de le faire. Nous avons établi un processus qui est fondé sur les éléments déclencheurs et sur les recommandations des autorités de la santé publique. Our plan has worked so far, and we have had success in getting outbreaks under control so far, but we need to stick to it. Since I was here last week, Zone 3 has also gone to the orange alert level. Many of you have had questions about what that means for schools. So just to reiterate, when a school is operating in an orange zone, staff and students of all ages need to wear a mask at all times in school and on school buses. Masks can be removed when students are eating, drinking, or engaged in physical education classes. And students in kindergarten to grade 8 can also remove their mask if they're working silently at their desk. Les cours d'éducation physique devraient être axés sur les activités qui permettent de respecter la distanciation physique, par exemple le yoga, la danse et la marche modérée. Les activités parascolaires, ce qui comprend les sports interscolaires et extramuraux, seront limitées à des exercices d'entraînement et d'habilité au sein d'une seule équipe. So, I repeat this because this is important because it affects so many families. I want to take this opportunity to remind teams in all regions to be vigilant in screening prior to both games and practices. Make sure your rosters and lists of participants are up to date and readily available if required. And this applies for all intramural, interscholastic, and extracurricular sports. So these restrictions, I get that they are disappointing to a lot of students and their families. I've heard from athletes, I've heard from the parents of athletes, concerned that this interruption or slowdown in their path towards pursuing their athletic pursuits. In addition to that, for students who aren't particularly athletically inclined, I certainly would have counted myself among that number when I was back in school, in high stress times like this, physical activity is an incredibly important way to improve mental health for everyone in the school community. And it can be very therapeutic for all members of the class, including teachers and support personnel. So far, we've done a good job in New Brunswick dealing with COVID-19 because our plans have been based on the best available evidence that's currently available. Unfortunately, at this time, that means that competitive sporting events cannot really continue. And we've seen some professional sports leagues making some similar decisions. And we're seeing this as well made in a context of a timeline where we are now being able to talk about what life will be like after COVID-19, about what will happen when we have a vaccine. So this is not an end to school sports. This is not a permanent restriction. This is hopefully a short, temporary measure to allow us to get through the end of the pandemic, get back to normal, and then get our teams back out on the field where they belong. So during this time, though, we're still strongly encouraging students and families to use every avenue they can find to stay active and healthy. Often that's a challenge in a regular New Brunswick winter. In this winter of COVID-19, it's even more important. So a message to families, if you can, play together, go for walks, runs, bike or hike together. Today, maybe you can go swimming down the street. Players, keep on practicing your skills and drills. Continue working on your workouts and honing your skills. And when we get through this again, we're going to have lots of opportunities to celebrate at ball games, at hockey games, and at all the activities that we all miss so much from this last year of interrupted life. And I can't wait to hear about all those success stories coming out the other side of this pandemic, to seeing again the passion of our athletes when they hit the field and seeing their success when they get out there and do their very best. But in the meantime, please, everyone, stay vigilant inside and outside of the classroom. Monitor for symptoms. If you're sick or you're experiencing any symptoms, stay at home. And if you're in doubt, please get tested. We've got to work together to keep our schools healthy and safe. And a message to teachers, I know you have children as well, and you face even more difficult decisions when you need to stay home and care for them. If you need to self-isolate for you or your child's sake, please work with your school on accommodations to work from home, and more information on how to do this is available through your school district. And if you have any questions at all, don't hesitate to reach out to school leadership, district leadership, or to me or my office as well. We need to help you get through the next few months. It's why the whole system that supports the education system is there to support teachers' job in reaching out and helping our kids learn. And it's an opportunity to say thank you again to teachers and to early childhood educators. The latter group that I think is still too often overlooked when we go through the list of people who've really helped us get through this pandemic. The early childhood educators who stepped up just a week after the province was locked down, left their homes, reopened their childcare centres, brought their staff back in, worked with staff from other centres, and they allowed our essential workers to go back to their jobs in our hospitals and across the province. So a thank you to them, and a thank you to the teachers who, in addition to having to bear the regular burdens that all of us do, of a life that's more confined, more isolated than nearly all of us would ever dream of or want, but at the same time, go to a school every day and engage with dozens of kids in some cases, and have to take on board the same weight the teachers have always had to take on board, of the experiences and trials and successes and failures of all the students in their classes, and the additional stresses those students have taken on are transferred to the teachers. That's what teachers do. And all I can say is I want you to know that your province recognizes the sacrifices that you're making, the burdens that you're taking on, and it won't be forgotten, and that we'll be here as much as we possibly can be to help you get through the next few months. We have a lot of successes to celebrate here in New Brunswick, and it's important for us to remember that, because while Dr. Russell and the folks from the government, we have to come up here and share bad news about cases, in some cases about deaths. On the flip side, there's the fact, the hard, cold fact, that New Brunswick, our province, has led the world in its response to COVID-19. Better than Australia, better than South Korea, better than just about anywhere you can possibly measure except for New Zealand, islands located, to their good fortune, far, far away from any other country or landmass. We did this. Not your government, not public health, all of you, by choosing to follow the science-driven directives that came from public health, that came from government officials. Because you looked at them and you thought, this makes sense. This sucks. This is a restriction on my life that I don't want or like, but it's worth it. It's worth it for a few more months, because this is how we get through this. We get through this with our cases low, with our economy relatively intact, and we come out the other side ready to take on the world in a way that New Brunswick hasn't been able to for generations. And that's a success that every New Brunswicker will be able to claim a part in. And it makes me proud to be a citizen of this province. So do your part for the next little while. Be kind. I've seen a lot of messages on social media the last few days that have been anything but. And I'm not going to complain about those, because people are frustrated, people are in some cases scared, people are tired. Long, dark days, being told you can't see the people you love. There's nothing good about this situation, except for the outcome. A province then comes out of this with less economic damage, in better health physically, able to withstand the mental health challenges with greater ease because we experienced less in the way of loss. Were imposed a grand total of 4 tickets handed out across the province, despite what you may see online, 4 tickets, because most people are following the rules, not because they're rules, but because they make sense. And we care for the people we live with and next to, people in our communities, in our towns, people who live in our province. And it's that caring that's going to get us through. So before I wrap up, I want to remind everyone the subject of mental health that I touch on regularly in these briefings. Virtual counseling is available for students through our schools. A variety of supports and programs are available in the schools, and there are also resources available through the COVID-19 website. So please continue to watch for any communications from your school, from school districts, or from public health in the coming days, remembering again that no news is good news. And of course, we're going to keep you up to date with as much information as possible. Folks know how to reach me in the department if they have any questions that they don't see answered here. And until then, let's continue working together to keep all New Brunswickers healthy and safe. This has not been an easy time, but we're getting close to the end. Let's stick with it, get it done, and then we can start to rebuild. Thanks so much.
Merci beaucoup, Monsieur Ministre. Dr. Russell, thank you, Dr. Russell. Mr. Cardy. We'll now proceed with questions from the members of the media. Each reporter will have one question and a very, very quick follow-up. You have the right to pose your question in the language of your choice, and I ask that you please ensure your microphones are placed on mute. Nous allons maintenant procéder aux questions des journalistes. Vous avez le droit de poser vos questions dans la langue de choix. Chaque journaliste aura une question et un suivi. S'il vous plaît, voulez-vous assurer de désactiver le son de vos micros. Laura Brown, CTV.
Hi, Minister Cardy. I'm wondering, I've been hearing that there's been a conversation about potentially moving or making Christmas break longer so that teachers have time to kind of catch up. Wondering your thoughts on this, where that conversation is at.
Hey, thanks for the question. We continue to have conversations about really everything to do with the COVID plan and how we're handling it in schools, from blended learning at high schools to dealing with sports. By the way, I should just clarify something that I think I jumbled my words when I was talking about school sports earlier, that those restrictions on games and competitions only apply in orange zones. So I know that affects a lot of people in the province right now, but just wanted to make sure that was clear. So if you're still in a yellow zone, then things carry on as they have been for the rest of the previous months of the school year. So in terms of extending the Christmas holidays, certainly it's one of the things we had looked at. And I know that a lot of teachers, especially, who keep on telling me that late November felt like June. I get that, and know that the teachers are looking forward to their Christmas break to be able to recharge. We're going to keep on looking at what makes the most sense, what additional supports are needed, but that's not ready to make any announcements yet. When we do have anything to bring forward, I'll certainly be here to say that. Juste brièvement pour dire que on a discuté la possibilité d'élonger la vacance de Noël Et c'est une des mesures qu'on regarde pour si c'est possible encore de réduire le stress sur l'équipe professionnelle dans les écoles et aussi sur les élèves et les parents aussi. Mais il y a seulement un élément d'une longue liste de choses qu'on regarde chaque jour et on va continuer de le faire, mais pas d'annonce aujourd'hui. Mais s'il y a quelque chose à annoncer, on va faire dans les prochains jours parce que c'est déjà le 1er décembre malgré le temps d'heure. Alors, ça va être une annonce dans les prochains jours pour qu'est-ce qu'on va faire pour le reste de cette année. Merci.
Merci, Monsieur le Ministre. Thank you, Minister. Laura Brown, do you have a quick follow-up?
Yeah, just a clarification. You said 8 Anglophone schools have a potential exposure in recent days, or has so far. Any Francophone schools affected by an exposure?
No Francophone schools have had an exposure. We've had one, I believe, French language operating early child care facilities. Bon, pas des écoles dans le système francophone jusqu'à aujourd'hui, félicitations, mais une centre d'éducation de la petite enfance dans le secteur francophone qui avait une exposition au virus, mais c'est tout. And the total is 8 cases in schools. C'est 8 cas dans les écoles en total jusqu'à aujourd'hui.
Thank you, everyone. Vicky Hogarth, Charlotte County TV.
Thank you, Bruce. My question is for Dr. Russell. Dr. Russell, can you provide us with a little more information about the super spreader event in Zone 2? Was it something that had a guest list, or was it a public place? And do you know if protocol was being followed and to what degree?
I'm sorry, Vicky, I don't have all of those details. Again, somebody had recommended that we use the opportunity as a teaching moment in terms of trying to explain what a super spreader event actually is and how easy, if you are at an event such as that, that transmission can occur with respect to the virus. So weddings, funerals, and other jurisdictions, we've seen that to be the case. And in this particular case, again, we've always known that there were risks with events such as this. And again, we can never predict whether we have COVID-19 and we're going to bring it somewhere that we go to, or whether an event that we go to will have somebody there with COVID-19 who can transmit. So that's why the physical spacing and mask wearing is so important. We know that even buffet style food is not recommended, and obviously hand washing is really important, and outdoor events are obviously better than indoor events.
Thank you, Dr. Ms. Hogarth. Do you have a follow-up today?
I do. It's also for Dr. Russell. Carpooling is critical for many families in rural parts of the province where there's no public transportation. Can it still be done safely in the orange level of recovery, and if so, how?
My understanding is that there is messaging that came out on that, and it is on our website. So there, if you can check the website, and Bruce can help if you don't get that. But yeah.
Thank you, Ms. Hogarth. Silas Brown, Global TV. Silas?
Hi there. This is for Minister Cardy. You mentioned that many parents are keeping their children out of school right now. Is this something that the department or the districts are noting? Is an increase in absenteeism? And if so, are these increases being attributed to fears of the pandemic anecdotally, or are these being reported by people who are calling in?
Both. We have formal mechanisms in place to start collecting the data, which we've been talked about this a couple of weeks ago, saying we're certainly not putting a focus on getting that data driven up from the schools to the districts to the department right now. Teachers have enough weight on their shoulders right now, and we recognize that any additional burden is a burden, and we don't want to add to that. So we will have that data to be able to look back on the pandemic and place it into context and see what damage has been done. But a lot of the information we're getting is anecdotal, but it's credible. You know, I hear from a classroom teacher that they had a large number of their students out in a given day, which tends to happen when a region has gone into red. I take that seriously. So it's again why I wanted to repeat the message that please send your kids to school. Yeah, I had people poking me on Twitter saying, oh, what are you going to do, send child protection services after? No, I'm not. No one's going to do that. That's not the point here. The point is to say that school is important. It's why we spend over $1 billion from our collective taxes on it. And the best way to make sure that kids can learn from the school system is to make sure they're in school when school is open. And I take Dr. Russell very seriously when she says that If she feels comfortable with her kids being in school here in an orange zone, then that's good enough for me. And we're absolutely continuing to look again at the epidemiology and take advice from public health to make sure we have evidence-driven decisions about what happens with our schools. But if it's okay for the schools to be open and it's safe for face-to-face learning, please don't deprive your kids of that opportunity. If things get dangerous, we won't hesitate to move to online learning. I promise you that. The same way we didn't hesitate in the spring to shut down the schools and shut down the province, that led us to being in the enviable position we are today, where we don't have to have big fights about schools being open or closed. Alors, en bref, oui, le problème d'absentéisme dans les écoles causé par le COVID-19, c'est clair. Quand une région fait la transition à la phase orange, j'entends que beaucoup d'élèves restent à la maison. Et je peux seulement dire que ce n'est pas une question de conséquences légales ici, c'est une question de responsabilité pour assurer la continuation d'éducation des jeunes. Et la seule manière que les jeunes peuvent continuer leur formation est s'ils sont dans les écoles. Et s'il y a une question que les écoles sont dangereuses, on ne va pas hésiter de les fermer. Mais pendant le temps que les écoles sont ouvertes, s'il vous plaît, laisse tes enfants aller à l'école. Et c'est une manière qu'on peut réduire le dommage créé par la pandémie. Merci.
Thank you. Mr. Brown, do you have a follow-up?
Yes, thanks for that, Minister. How do you get the message across to people to make them feel safe sending their children to school? Obviously, we're a couple months into the school year here, and as you mentioned, when zones get downgraded, there seems to be a dip in attendance. How do you get that message across to make parents feel safer about sending their children to school?
Well, I hope partly through events like this, and thanks for that question. One of the ways is to remind folks of why we have the measures in place that we do in our schools. That from September onwards, from the days that school first started up again this fall, we had measures in place that were designed to really stay pretty much the same, even if a region had to shift to orange, with just some of the minor changes that I listed today. So we already had the system in place designed to try and hold the virus at bay, keep it out of our schools, and if it did come in, which we always expected it would, that the measures we have around social distancing or around reduced class sizes or the hybrid learning that we're seeing at the high schools, all those measures are intended to push the virus back out of schools if we do have cases. And so far it's worked. So initially, I thought we had a good plan. Now, after several months, I can say, based on the experience of having the virus hit a number of schools and without having seen widespread outbreaks linked to those schools, that so far the plan is working. And so that's my only request to parents is look at the evidence. And then also, as much as it's difficult when you're caught up in the routine of your day-to-day life and the stress and the justifiable anxiety you have about having kids in a time of a pandemic and having to see them go out the door and wondering what they're going to face, step back, look outside our borders. Look at a state like North Dakota, comparable in population to us. They've had 927 deaths. 1 out of 800 people have died in a place that's similar to us. We don't have to deal with those issues here because everyone did their part and has done the right thing, and now we're getting towards the end. Just keep it up. Alors, en bref, la seule demande pour moi, de mon côté pour les parents, est s'il vous plaît, regarde l'évidence. Regarde le fait que jusqu'à ce moment, on n'a pas eu les grandes éclosions dans les écoles, et c'était toujours la base de notre plan pour éviter les éclosions dans les écoles, et quand les éclosions arrivent, pour assurer qu'ils sont assez restrictés, que ça ne crée pas les grands dommages dans les écoles. Que les écoles, les étudiants, l'équipe scolaire ne deviennent pas une vecteur de transmission pour le virus. Alors, s'il vous plaît, regarde l'évidence et s'il vous plaît, envoie tes enfants à l'école. Je te jure, on va fermer les écoles s'il y a une question de danger. Merci.
Thank you, Minister. Thank you, Mr. Brown. Jean-Philippe Higues, Radio-Canada.
Oui, bonjour. La question est pour la docteure Russell. La présidente du réseau de santé Horizon, Karen McGrath, disait plus tôt aujourd'hui que dans certains hôpitaux, 8 ou 9 hospitalisations pour la COVID-19 pourraient placer l'hôpital dans un état vraiment de difficulté. Est-ce que ça illustre l'ensemble du système de santé? Est-ce que c'est aussi précaire en ce moment?
Je n'ai pas entendu la question entièrement. Pourrais-tu la répéter, s'il vous plaît?
Oui, je peux répéter. Donc, la présidente de Horizon, Karen McGrath, disait plus tôt aujourd'hui que dans certains hôpitaux, s'il y avait 8 ou 9 hospitalisations pour la COVID-19, l'établissement serait en difficulté. Est-ce que ça illustre l'ensemble du système de santé au Nouveau-Brunswick et est-ce que ça vous inquiète?
Alors, pour nous, la surveillance de la capacité des hôpitaux au niveau des soins intensifs, puis les lits, les chambres et aussi les ressources humaines au niveau des infirmières puis des médecins, ce sont toutes des choses qu'on surveille et on utilise cette information pour informer nos décisions pour aller à la phase orange, à la phase jaune, à la phase rouge. Et quelque chose qu'on a appris au commencement de la pandémie dans la phase rouge, c'est pour nous assurer que la capacité était là dans les hôpitaux au commencement parce qu'on savait vraiment pas à quoi on s'attendait au niveau des nombres de cas. Mais au commencement de la pandémie, on a quasiment vider les hôpitaux pour voir quelle était la capacité quand les hôpitaux étaient vides. Mais après qu'on a fait ces exercices avec les réseaux, c'était clair que quand vous avez de la capacité 100% juste pour le COVID, ça veut dire que tous les autres services arrêtent. Ça veut dire que les chirurgies, le département d'urgence ne fonctionnent pas dans la même façon. Alors, pour nos phases orange et jaune, c'était toujours le but d'avoir le plus de capacité, je ne peux pas donner un pourcentage, mais le plus de capacité possible pour continuer à offrir tous les autres services de santé, en même temps qu'on pourrait aussi offrir des services de soins intensifs pour les gens qui seront hospitalisés pour le COVID-19. Alors, la manière qu'on mesure ça maintenant, c'est quelque chose qu'on communique avec les réseaux chaque jour quand il y a des éclosions à zone 3, zone 2, zone 1. Et même dans l'éclosion de zone 5 qu'on a eue, c'était vraiment quelque chose qu'il fallait qu'on surveille l'effet, l'impact sur l'hôpital à Hamilton dans ce cas-là, dans cette situation, mais aussi s'il y a un effet sur un hôpital dans un réseau, ça peut impacter des autres hôpitaux dans d'autres régions. Alors, c'est vraiment quelque chose de balance. À ce moment-ci, je n'ai pas les faits comme tels, sauf qu'en général, on sait que dans les éclosions, après un tel nombre de cas en total, on va voir des hospitalisations, mais d'habitude, c'est des gens qui sont plus âgés parce que les risques sont plus élevés. Alors ça, c'est quelque chose qu'on surveille aussi.
M. Hugues, as-tu un suivi?
Oui, avec une centaine de personnels de santé en isolement du côté d'Horizon, qui ne reçoit pas de soins en ce moment? C'est qui les premiers qui n'ont plus leurs soins?
Les seules choses que j'avais entendues au niveau des soins, c'était vraiment les effets de les gens qui font partie des ressources humaines, soit des infirmières ou d'autres employés. S'il fallait qu'ils soient en isolement, ça veut dire que je crois qu'il y avait environ 80 ou plus de gens qui étaient en isolement pendant 14 jours. Mais ça, c'était supposé de finir, je crois, aujourd'hui. Alors, les 80 gens qui manquaient du système sont replacés dans le système maintenant.
Merci, monsieur. Merci. Natalie Sturgeon, CBC.
My question is for Dr. Russell. What does public health know about the source of the Parkland St. John outbreak? And as the local union says, a source has not been identified, at least to them. And will public health investigate the report of an ill employee being asked to report duty at Parkland St. John?
Well, certainly I can tell you that my understanding of all the cases in St. John, as I have mentioned, are that all the cases in St. John are linked. And that's all I can say really about the source of the Shannox, other than that they are all linked. And with respect to how the Shannox and Parkland, et cetera, are being supported right now, our prompt team is working there, so that has people made up from public health and Ambulance New Brunswick and extramural, et cetera, working on the ground there. And so whatever other pieces of information that need to be investigated through that route, they would be.
Ms. Sturgeon, do you have a follow-up?
Dr. Russell, I mean, what is the messaging to the families who have loved ones in there who may be seeing the reporting of an ill employee who has been called back into work during an outbreak?
Well, I can't speak to specific situations, so I'd rather not comment on that. But again, whatever has to happen within that facility in terms of follow-ups, then that would be done at the facility level in conjunction with the prompt team that's working there right now.
Thank you, Ms. Sturgeon. Marie Sutherland, CBC.
Hi, my question's for Dr. Russell. There are a growing number of accounts of backlash over enforcement of rules, particularly mask rules, including some very public incidents posted on social media. Can you please clarify the rules around medical exemptions for wearing masks? Do people have to, with a medical exemption, have to provide proof of this exemption? And do residents have to provide their ID when asked?
My information about masking would be the same information that's on our website around exemptions, et cetera. And my understanding is there are a certain number of situations that an exemption would apply. However, again, my understanding is that if a service establishment does not want to serve somebody without a mask, it is within their right to turn them away. But my understanding is that they are supposed to provide some kind of alternative for whatever service they're providing, whether it's pick up at the outside the door, et cetera. So that's my understanding, and again, that information is on our website.
Sutherland, do you have a follow-up?
Yes, also for Dr. Russell, why did the province feel it was necessary to move immediately to ticketing and arrests rather than warnings within the first day of orange phase rules? And do you feel these rules were clearly communicated to the officers enforcing them?
Well, we have a lot of people who work with our Department of Public Safety folks, including some public health inspectors. And the situation in Zone 5 previously around making sure that actually they were working with WorkSafe people as well to make sure that establishments were following their operational plans, making sure that they had an operational plan. And certainly it was around the risks that we knew were contributing to the transmission of COVID-19 in that particular outbreak. And so what we try to do in these in all three zones recently is take a look at the transmission patterns, take a look at the risks, and where can we provide education and support and enforcement around what things weren't being followed, where the gaps are. So I can't speak to the issue specifically around how they approach that if people were not happy about that, but certainly the intent was to make sure that people have the education that they need to follow public health direction.
Thank you, Ms. Sutherland. Lynette Paul, Radio-Canada.
Bonjour, merci beaucoup, Bruce. Ma question est pour le ministre Dominic Cardy. Alors, j'aimerais faire le point sur l'état de la situation dans les écoles. Si j'ai bien compris, vous avez dit qu'il y a 8 cas de COVID-19 dans les écoles de la province à l'heure actuelle. Pouvez-vous nous dire combien d'enseignants et d'élèves qui sont présentement en isolement?
Non, je ne peux pas répondre à ça à cause du fait que ça, c'est une information qui est privilégiée dans nos lois et réglementations pour la protection d'informations et d'identité. So I'm afraid I can't give information about students versus teachers, EAs, etc. It's against our rules and privacy laws.
Si, Monsieur le ministre, Mademoiselle Paul, as-tu un suivi?
Ben, juste à ma question de suivi, je ne demandais pas l'âge des élèves. Je demande vraiment le nombre de personnes qui sont en isolement.
Le nombre de gens dans l'isolement qui sont liés à les écoles, non, on ne donne pas ça. On a seulement l'information basée sur les différentes régions, le montant de gens qui sont dans l'isolation. Par exemple, dans la région de Saint-Jean, je sais que c'était plus de 1000 quelques jours passés. Ça, c'est le plus détaillé que je peux être si je reste en accord avec la loi. I can't give any real details around breakdowns of how many people are in isolation or anything like that. We do the information is provided based on regions only, and that's been the directive from Public Health. I'm going to take advantage of being at the microphone, by the way. I talked earlier about, it links to the question that Dr. Russell was asked about enforcement. And I mentioned earlier about how there was 4 tickets given over the course of the 5-day enforcement blitz following the move to zone to orange phase. 4. So all the stuff you see on social media around people being arrested in parking lots and things like this a large amount of this is simply not accurate. And again, please take information from reliable sources. And the fact that we've come to view reliable sources as being random people on the internet, as opposed to government officials who are legally accountable for the things that we say and do, is in the end probably going to be a virus that is the virus of misinformation that's going to be even more dangerous in the long term to the future of democracy and our civilization than anything COVID-19 could have thrown at us. Juste pour préciser que, en réponse à la question de Dr. Russell sur l'enforcement dans de phase orange, on avait 4 billets, 4. Toute l'information partagée sur les réseaux sociaux, les médias sociaux, un énorme montant de malinformation qui est encore plus dangereux que COVID-19. S'il vous plaît, prendre l'information des sources autoritaires, comme le gouvernement, les gens qui sont absolument responsables pour les choses qu'on dit, les choses qu'on fait, pas les gens sur les réseaux sociaux qui sont en train, pour les raisons ou d'autres, de créer la malinformation et de créer la panique avec les gens. We have enough real things to be worried about today without adding made-up things onto the list.
Merci beaucoup. Je pose ma relance maintenant. Je comprends, M. Cardy, que vous étudiez la possibilité de prolonger les vacances. Pour donner une meilleure idée aux parents, quels sont les éléments que vous considérez? Qu'est-ce qui fera en sorte que vous opterez de ne pas prolonger les vacances?
La seule raison pour prolonger les vacances, c'est 2 raisons que j'ai entendues qui sont, de mon avis, raisonnables. Premièrement, élonger les vacances pour les gens qui ont besoin de vacances après une période assez stressante. À l'autre côté aussi, le fait que si on ajoute quelques journées aux vacances, ça peut élonger la période entre les voyages, que peut-être les gens ont encore l'intention de prendre des voyages. Et si on peut réduire augmenter le montant de temps entre la terminaison des voyages pour les vacances et le retour à l'école, ça peut minimiser l'opportunité de notre éclosion dans la nouvelle année. C'est quelque chose qu'on veut vraiment essayer d'éviter. So we want to try and avoid, the purpose of possibly extending a Christmas holiday would be to first give an extra couple of days of Christmas holiday to people who desperately need it. And on the other hand, the possibility of reducing further exposures from people who maybe, against all advice, take trips during Christmas. When they come back, if there are more days added between the day they arrive and the day that school starts again, it further reduces the chance of infection. Again, it is only one thing that we're looking at. There's certainly no commitment to doing it, simply something that we're examining. Thank you.
Thank you. Merci, Mademoiselle Bobby Jean McKinnon, CBC.
Yes, thank you. Dr. Russell, we're hearing reports that some people caught up in the super spreader event in St. John took it upon themselves to self-isolate and get tested despite not being contacted by public health and have just tested positive. Are you able to confirm and explain why some people who were at these settings were not contacted, and tell us how many other such cases you expect to see from this?
So I can't speak specifically to this issue without compromising confidentiality, but what I will say is that in a situation where the close contacts can be contacted, they are contacted directly, but in a setting where there could be other people who are potentially at risk, it would have been communicated either through the public exposure notifications that we've had or to the event or events organizers themselves that everybody should self-monitor for symptoms. So just because you're not a close contact doesn't mean that you may not have been exposed. And people usually in that type of situation would be told to self-monitor for symptoms and get tested if they did develop symptoms.
Ms. McKinnon, do you have a follow-up?
Yes, I do. For Dr. Russell again, Public Health said Friday it was investigating after some people's COVID online test requests were lost in the technical glitch involving fax machines that led to the backlog in St. John and Fredericton. What is the latest on this investigation, and where does the test backlog stand?
My understanding is the backlog, in terms of what information they do have, has been cleared up, but in terms of the gaps where if there was something that got missed or lost, that those people, if they make up part of the group that said they had waited for 7 days, we are inviting them to resubmit another online form or call 811 and get tested. And in terms of the investigation, sorry, to address the question about the last conversation I had with all the partners involved, including one of the VPs at Horizon, they are looking into it, but I haven't heard an outcome from their investigation.
Thank you, Ms. McKinnon. Erica Butler, CHMA, Sackville.
Oh, hi there. This is for Dr. Russell. New Brunswick has done targeted asymptomatic testing in the past during the last Campbellton outbreak, and I noticed that the town of Wolfville, Nova Scotia, detected COVID in their wastewater, and the province followed up with a pop-up rapid testing event in the town. I'm wondering, will New Brunswick be making use of either of these measures, either this early alert wastewater testing or targeted pop-up rapid testing in response to localized outbreaks or areas of concern?
Both great questions. Number one, around the wastewater testing, we actually have been collaborating with some of the wastewater testing folks that are doing research in the Moncton area. So I'm not sure how much contact they're having with the Regional Medical Officer of Health in this particular outbreak, but the previous Zone 1 outbreak, they did, my understanding is they did do some work together to sort of make correlations between what they were seeing in terms of case numbers and the wastewater testing. So that's ongoing and sort of evolving, but it's not a carved in stone approach at this time. We're all still learning. The second question around mass testing. Obviously, if there's community transmission, then that was the case, what we thought was the case in Campbellton and Dalhousie and in Zone 5. So that was why we deployed the rapid testing or the mass testing for those two sites at that time. And out of 2,400 tests done over 2 days, we had 2 positive results, which was good in the sense that we found those people that were positive. But in the end, there wasn't a large amount of community transmission, but we did cover our bases in terms of, again, being able to make sure that we could go in and do that type of testing if necessary. In the zone, in the St. John zone, Zone 2, we're not seeing community transmission. We have seen all the cases in the Zone 2 all have been linked. So we are not seeing a need to do mass testing at this time for that reason.
Thank you. Geneviève Normand, Radio-Canada.
Oui, bonjour. Ma question est pour la docteure Russell. J'aimerais qu'on clarifie la question à propos de qui peut rentrer en zone orange au Nouveau-Brunswick. Il y a des gens de l'extérieur de la province qui peuvent venir, qui peuvent rentrer. Est-ce que vous m'entendez?
Non.
Oh, t'avais coupé le son à
OK.
couper.
Est-ce que vous m'entendez bien?
Oui.
Vas-y.
OK, alors, je voudrais clarifier qui peut se déplacer en zone orange au Nouveau-Brunswick. Parce qu'à l'heure actuelle, la Dr. Russell, je pense que les gens peuvent continuer de rentrer au Nouveau-Brunswick, c'est-à-dire la famille immédiate, frères, sœurs, père, mère, conjoint, ce genre de relations-là, donc peuvent rentrer au Nouveau-Brunswick. Est-ce qu'ils et elles peuvent se rendre dans les zones oranges?
Oui, à mon avis, oui, ça c'est possible, mais il faut qu'ils fassent leurs 14 jours d'auto-isolement quand ils viennent dans la province. Et si c'est dans la zone orange qu'ils vont, c'est là où ils vont faire leurs 14 jours d'auto-isolement.
As-tu un suivi,
Donc,
Mademoiselle
oui,
Normand?
Oui, alors vous me confirmez que c'est possible, donc les gens d'autres provinces peuvent rentrer en zone orange. Qu'en est-il pour le temps des fêtes? Vous avez déjà dit par le passé vouloir limiter les contacts étroits à 6, mais ça me semble en tout cas être une recommandation. Est-ce que c'est une directive claire et ferme de la santé publique du Nouveau-Brunswick ou c'est encore à ce jour une recommandation? Autrement dit, c'est pas interdit, mais c'est ce que vous recommandez. Parce que beaucoup de gens, Madame Russell, se posent la question, le Noël, ça s'en vient assez rapidement. Il y a des gens qui pourraient traverser la frontière. Quelles sont les directives claires de la santé publique?
Alors, les messages clairs de la santé publique sont toutes les informations qui sont écrites sur notre site Web. Les recommandations qui vont en hors de les directives qui sont dans notre arrêt obligatoire, c'est quelque chose qu'on va continuer à réviser, puis on va voir des recommandations plus tard cette semaine sur tous les voyages pour les fêtes. Et ça va inclure les étudiants, etc.
Merci, Mademoiselle Normand. Savannah Odd, Telegraph.
Hi, my question is for Dr. Russell, and it's on rapid testing. I'm wondering, have we received our allotment from the federal government? And if so, are we using those yet, and in what settings?
So my understanding is we have received them, and I think that it's still under discussion how they're going to be used. We do have a testing strategy, and the testing strategy does outline all the different types of testing, whether it's the PCR, whether it's rapid testing, and there are different rapid tests. So some people say rapid tests, which we are using some right now, which is the Gene Expert. But yes, there are some other rapid tests that are now coming to us. But there are also things that we call point-of-care tests, but they have a lower sensitivity and a lower specificity. So there are different situations that these different types of tests can be used in. But it is in our testing strategy to continue to roll those things out.
Ms. Odd, do you have a follow-up?
I do, thank you, Bruce. It was actually reported a few days ago, I believe, by the Toronto Star that there are plans, I guess, for New Brunswick to use rapid testing in rural emergency rooms for now. So I'm not sure if that's the case, if you want to confirm that. But I'm wondering if we're going to do kind of what we're seeing in Nova Scotia with walk-in rapid test days, I guess, and in Ontario with using them to allow more family visits in long-term care homes.
I don't really have any updated information on that at the moment, but I can get back to you on that. What I do know is that, again, with our testing strategy, all of those different components are part of that. So when and where to use it, what types of patients, whether they're symptomatic, asymptomatic, whether they're pre-op tests, et cetera, rural areas, those are all different components with respect to the tests, but rural community hospitals did receive them at this time.
Thank you, Ms. Odd. Jim Dunville, River Valley Sun.
Thank you. This is for Dr. Russell again. We already touched on this a bit about the medical exemption for wearing a mask. I just want to clarify. Does anybody claiming a medical exemption have to produce a doctor's certificate, note, card, something showing that? And if so, what does a store owner or a business have to do? Do they have to honor that card?
So my understanding is they do not have to show an exemption, but the business owner or the operator of a site of whatever service they're offering does have to offer some alternative to accommodate the person that can't wear a mask. So again, curbside pickup, online help, those types of things.
Thank you, Mr. Dunville. Do you have a quick follow-up?
Yes, just so in other words, I just want to clarify this. If they don't want to wear a mask, say they have an exemption, the store owner is required to offer them some sort of a backup service, but they are under no obligation to let them into the building or sort of otherwise. But they should offer to shop for them, bring it out to meet them in the step or something of that nature.
That's correct.
Thank you, Mr. Dunville. Tom Bateman, Times and Transcript.
Oh, good afternoon. This one's for Minister Cardy. I just wonder why we aren't identifying which track or cohort of students is implicated in an exposure to COVID-19 in a high school. This, would relieve a lot of stress from, half of the student population in their community. And it's a measure that's been taken, across the province. Why can't we do that?
Well, we have been listing numbers of cases in schools, which in some cases does give you an idea of ages, if it's a high school, middle school, elementary school. But we're not giving additional information to that because that's not the information that we're provided from public health. And it's not seen as necessary for fighting back against the pandemic. Alors oui, absolument, on partage l'information sur les nombres de cas d'exposition, par exemple, au COVID dans chaque école. Et des fois, ça, c'est assez clair pour donner l'information sur l'âge des jeunes qui sont impliqués, si c'est dans une école secondaire, primaire, etc. Mais on ne donne pas plus d'informations de ça parce que ça, ce n'est pas l'information qu'on a de santé publique. Et ce n'est pas l'information qu'on a besoin pour combattre le virus. La santé publique être eux-mêmes responsables pour contacter chaque famille dans chaque cas qu'il y a une exposition ou un cas. So just to reinforce that, the public health, they reach out directly to each family if there's a case or a possible exposure. So that's their job. Our job is to support them in the work they do to keep the virus out of our schools. Thanks.
Mr. Bateman, your follow-up?
Yeah, again, for the minister, I appreciated your comments around misinformation as it relates to enforcement and that sort of thing. In the update, there's been 4 tickets issued across the province. Can you give us some more information around non-compliance orders? What kind of enforcement has been done with businesses and that sort of thing? We heard kind of a reference to a business in southeastern New Brunswick being quote shut down at a previous press conference. Can you just give us some more information on what enforcement measures have been taken or not taken?
Yeah, that information is being shared by the folks from public safety, certainly not outside of my department. But it all links back again to the core issue around making sure that we get information from reliable sources, and that we have seen over the last number of days a huge amount of misinformation around people making it sound like we're having game wardens mugging people in the streets of downtown Fredericton. It's just simply not true. And the more those sort of rumors circulate, the more people question whether or not everyone is all in this together and start to feel targeted. And that's not the intention with any of these rules. The intention of these rules is to put them behind us so we can get rid of them, so we can put the virus behind us, and get back to life as normal, try and build something better. C'est pour les questions dirigées sur les questions d'enfoncement des réglementations sur les entreprises, etc. Ça, c'est les questions qui devraient être posées pour la sécurité publique. J'ai l'information comme membre du cabinet, mais en grand détail, c'est le ministre Fleming et son équipe qui devraient répondre à ces questions. Mais je peux juste dire encore qu'on a besoin vraiment de cibler la crise de malinformation qui est en train d'infecter nos provinces comme le reste du monde aujourd'hui. Et quand j'entends des histoires sur les réseaux sociaux qui entendent que c'est comme les gens en uniforme sont en train d'attaquer les gens dans des rues de Fredericton, ce n'est pas vrai. Et on a besoin d'utiliser l'information correcte et basée sur les faits si on veut vraiment combattre la malinformation qui nous aide de combattre le virus. Merci.
Simon Delatte, l'Acadie Nouvelle.
Oui, une question pour la docteure Russell. Je voudrais confirmer simplement au niveau des infections de propagation communautaire. Est-ce que vous m'avez dit tout à l'heure que vous n'avez pas pu établir de propagation communautaire dans la zone 2? Est-ce que vous pouvez confirmer que c'est le cas pour les autres zones?
Je m'excuse, peux-tu répéter la question?
Oui, pourriez-vous confirmer qu'il n'y a pas eu de propagation communautaire, de transmission communautaire dans les autres zones? Vous avez nommé la zone 2 tout à l'heure. Est-ce que vous pouvez confirmer que vous n'avez pas eu de transmission communautaire dans les autres zones?
La seule chose que j'ai entendue, c'est la transmission communautaire. Puis si vous parlez de la zone 2, il n'y en a pas de transmission communautaire dans la zone 2. Mais par rapport dans la zone 1, il y a 2 cas qu'on vient juste de mettre sur notre site web pour indiquer que il y avait 2 cas qui sont la transmission communautaire dans la zone 1.
Simon, as-tu suivi?
Non, merci beaucoup.
Okay.
Jennifer Sweet, CBC.
Oh, I just wanted to come back to Vicky Hogarth's question.
Okay.
Sorry, if Vicky's still on the line.
There she is.
The issue around carpooling. So carpooling with others for work, school, medical appointments, or to access essential services such as groceries is permitted. When carpooling, continuous masking and maintaining a physical distance is required, and if possible, only transport passengers outside your single household bubble in the back seat. And drivers must screen potential passengers for signs of illness, and drivers or passengers who are ill or who have been told to self-isolate by public health must stay home. Maximize the ventilation in the vehicle and do not recirculate the air. Clean and disinfect all surfaces that may have been touched by the passengers. So that information is available online. And then that is in the orange zone, so zone 1, 2, and 3 at this moment. And the other thing, there was another question that somebody had asked around people coming into the province and if they were entering the orange zone when they were coming into the province. So those travelers, yes, they have to self-isolate for 14 days, and they also have to limit their contacts to maintain a one household bubble. And students who are returning to New Brunswick for the holidays are not eligible for the testing on day 5 and 10 to shorten their isolation. So that's really only available for workers.
Thank you, Doctor, for the clarifications. Jennifer Sweet, CBC.
Thanks, Bruce. A question for Minister Cardy. Why are students from the Amherst area not being allowed to attend Tantramar High School right now, while they can go to elementary and middle school in Saco?
Thanks for the question. So it's the same principle that we've applied for the kids from Listigouche First Nation and Pointe-à-la-Croix in Quebec, where recognizing the extra burden that in terms of child care and other supports that are needed for young kids up to the age of 12, that for purely compassionate reasons, and this is the government of New Brunswick doing our best to try and make sure we don't cause disruption in the lives of families who come to depend on our government services, we're offering that chance for those younger kids to be able to come to school in New Brunswick. But for the high school kids, we're not. We have to reduce our exposure, and that's the only way we get through this. And that's been the message that's helped us reach this point where we're continuing to do very well on a global scale. It's reducing the exposure, reducing the number of people we're in regular contact with, reducing the number of close contacts. And that applies at the provincial level as well when it comes to people coming into our borders. So it is absolutely not perfect. We want to get this situation fixed as soon as we possibly can. But for the moment, it's entirely consistent with our policy that we've had in place for the kids on the Quebec side of our border. And now, unfortunately, the same rules are applying for the kids in the Nova Scotia side. And we're also continuing to offer for the high school students in both Listigouche and the kids from Nova Scotia blended learning, the same learning option that we'll have in place if we have to, and hopefully we don't, move a region in New Brunswick into red to have online learning, that those students are able to access that now. Alors pour les jeunes de Nouvelle-Écosse, c'est la même réglementation qu'on a mis en place pour les jeunes de Listigouche au Québec. La même réglementation exactement. On a des options de formation en ligne, à distance, pour les élèves de secondaire en Nouvelle-Écosse, le même qu'en Listigouche au Québec. And I got a note on Twitter from a bus driver saying that I'd forgotten to thank them. I do thank bus drivers for all the work they do. As he put it, driving in a tin can full of kids, not being necessarily at their most hygienic, back and forth. They're doing a lot of incredible work for our province, always have, and I'm sorry I left them out. Je veux remercier aussi les conducteurs d'autobus pour tout le travail qu'ils font pour notre système.
Thank you, Minister. Ms. Sweet, do you have a follow-up?
I do, if I can. I would ask Dr. Russell, why is it okay for people to not wear masks at sports practices and dance classes in orange level right now?
My understanding is they actually do have to wear masks in the orange phase at sports activities and dance classes.
Okay, thank you.
Thank you, Ms. Sweet. Voilà la fin de notre mise à jour. Merci beaucoup. Thank you, everyone. That concludes today's update.